So the recommendations to reduce tick-borne diseases are pretty well laid out. There are a lot of websites where it's described. The CDC, I know, has it, for instance, but basically it's and probably a lot of outdoors. I'm not even talking about medical websites. If you go to these outdoors camping websites, but basically they talk about, first of all, mosquito, or I should say insect repellent. Ticks are not insects, but technically arthropod repellents, but things with that you use to repel insects would repel ticks to some degree. But also, I always thought these recommendations I'm about to say are very nice, except they're very impractical. I mean, if you're out in the summer hiking in a 90-degree day, you're not going to wear long sleeves, long pants, wear socks, and tuck the pants legs into the socks. But those are the recommendations. Obviously, the more exposed skin you have, the more likely you are for a tick to land on you and bite you. The problem with tick bites is they are painless, and the ticks that spread Lyme disease are particularly tiny, so that people have looked directly at a place like an arm or a leg or something where they have a tick attached, and they don't even realize it at first. It's not unusual for somebody to say, "Oh, I looked down, I thought I had a little mole there, and then I realized the mole had legs and it was wiggling." And I said, "Oh, I guess that's not a mole." So that's a problem. But on the other hand, what we have to our advantage with the bites is it's not like mosquito-borne illnesses, where if a mosquito carrying, we talked about Zika before, if a mosquito carrying Zika virus bites you, within a matter of seconds you can get infected. A tick has to be attached for approximately 24 hours or more in order to spread the infection with Lyme disease. So if somebody is out hiking in the woods or out gardening or playing football in a field or something, if they come in a couple of hours later and get undressed and shower, if they just look themselves over, even if it's not a few, I mean, even if it's in the morning and they go to sleep that night and they're showering before they go to sleep, if they just sort of inspect their body, and obviously with children, if the parents do it with the children, because children aren't going to be responsible enough to do that, but it's parents inspect their kids, if they don't see ticks, then that's a pretty good sign. The one caution is to look in areas where you wouldn't ordinarily think to wash or to look in the hair, because if there's ticks in the hair, they may go missed, because they're not readily seen. And also certain other places like body creases, like people will frequently say they pulled a tick out of their groin, because you won't see it there. Even if you go in the shower and you're washing up, these are small, so if it's in a crease in the body or under the arm is another place, they may get missed. On the back of the neck, somebody won't see it themselves, so you have to ask somebody obviously to look. But vigilance is the biggest thing. So, and then if you come in, as soon as having been outside, if you come in and shower right away, that's also helps, because a lot of times ticks are sort of crawling and haven't attached yet.